data provisional specialist, and he will present jointly the next presentations with Michael Mertz, with drug safety expert at Novartis, and they have both a particular interest on usage of graphics to improve the understanding of clinical data.
Thank you. First of all, when I was asked to speak here, the first thing I did was go online. And I found this on YouTube, which is Good Presentations for Views by Sasha Auweiler. This was last year, so I want to thank Sasha for that, because it's going to help with my presentation here. So what he said is to present a problem to the audience, give them a proposal on how you want to deal with that problem, show them the advantages of that proposal, and then leave the audience to take away action that they can go back and use of your presentation. So the problem that I was going to present is, when is it too early to create visualizations for a clinical study? If we take a look at a clinical study timeline, very simple clinical study timeline, we always have a protocol development. We need to build our database to start collecting data. We start getting data in. We might or might not have some type of interim analysis, and then we're going to have the final analysis at study close. Along the way, there's a series of problems that might get in the way, like we do not have clean data. Also, our database might not even be in-house. It might not even be in the same country because it's hosted somewhere else. There is a load of problems that can come up around study design. The easiest way is to get rid of all of this and just ask the question, where's the best point to start visualizing data? Not looking at data, but visualizing. It becomes very obvious because it's right in the middle of the screen. We want to start looking or visualizing data as soon as we get it. So the very first time we get data, we want to be able to start visualizing it. We can do that by saying we have a standard data tabulation model that we're going to work off for all studies. So we already know what the data is going to look like before it starts coming in. Now that we have all of our studies in a standard data tabulation model, we can also start setting up standard templates for visualization. So these are templates that we can use again and again for different studies to start looking at the data. What I'll show you next is those actual templates. Basically, what we're trying to do with these templates is, as soon as we get data in, we want to have a one-day turnaround on getting these visualizations set up so that scientists, data managers, clinicians can start looking at the data one day after the data is for that. So here's one of the very first ones that we'd have set up, is basic demographic details. You can see we also have some study milestones to look that patients have completed or have signed informed consent, and maybe the study visits. When data first starts coming in, this is not going to look like very much. The point is that this same visualization is being used over and over as data comes in. So as new data comes in, the visualization always points to the newest data. So we build this once and then use it for the entire study. You can also see that we have some basic medical history. As I'm going through this, off to the side, we've got a patient select, so we can start changing the patients. And we can also start clicking to get more information along the side. I also apologize, but I'm presenting some data tables at a data visualization conference. Right now, it's the best way to look at the data, especially at the early points. So you can see as we start clicking through, it starts filling up the data tables. And we can keep going through. So this is as interactive as you want it to be. We try and make it as simple as possible for everybody involved so that the templates are as easy to use as possible. So we try and put filters for the most common uses along the side, but the entire data is loaded into Spotfire. If I go on to the next one. So here's a medical history. You can see it's the same type of thing. We've got our controls along the side to start picking patient numbers, and then we've also put in a body map image so that people can start clicking on certain body part or certain body parts in the body map and start populating the rest of the tables. So if we keep going down and clicking on this, we can keep populating the tables below. And in Spotfire, it's very easy to actually just expand the table so that we can get a better look at it. If we want to actually start selecting everything, here again, it's very easy to start selecting everything. It's going to give us counts and starts adding things in. So this is all done at runtime when the users actually need it. So we try and make these controls as easy as possible. The visualizations that I'm presenting, like I said, these are our templates. So this is a starting point for further investigation. Everything we have is fairly simple. You can see here something that we have for our AEs, where we just have the plain study day along the bottom, the AEs listed along the side. This is by patient again. We have it color-coded by toxicity, so you can see green is your most non-toxic, up to red being your most severe. It also includes the line for dosing, so you know right away, was that AE related to a possible dosing event? As soon as we go into the next one, we've also now added in more controls, so along the left-hand side, we can start setting the graph so that if we see something way beyond day 0, we can set our graph to day 0 so we know we're only looking at that since the patients come into the study. So it's basically adding in user controls, making it more interactive. Here again, we've got our AEs on the top with the same as before, but now on the bottom we've got conmeds, so that you can start lining up AEs to conmeds on just pure study day and see, as an AE came in, did they take something for that adverse event? We try and present the data in as many different ways as possible. So here again, we're just presenting the intensities of the AEs. So we've got our listed AEs by patient, the outcome of the adverse event, and again, the toxicity grade. We want to give the users as much different variety of looking at the data as possible so that they can interpret the data from the best way, from the graph the best way if they want. Pull this over. The very last one we have is looking at some RESIST data. So this is for a cancer study, and here again, it's just pulling in all the data into a tabular format, maybe having some graphs at the bottom with the individual target lesions, so how the diameters of individual target lesions at each cycle, and then the total target lesions, so if you're looking at more than one tumor growth. We do the same thing with the responses, so now we're calculating the overall response for that target lesion, and maybe a change from baseline and a change from NADAR as well. So you can see this is all set up as first patient in. The thing that really makes Spotfire powerful is that we don't have to do any manipulation of the Spotfire file after we've done this initial setup. As data comes in, Spotfire will continually add that data to its visualization. And then maybe the very last thing is just overall response. Here again, we're just looking at the overall response of any tumors. So we've got our target response, and then an overall response, a best response, and our non-target response. So depending on the tumor, how each responded. Here again, color-coded, the easiest way to represent the information, but it's easily changeable. The biggest thing is we try and give the user controls so that we're not generating a graph for them and then having them come back and make changes. We want to be able to make those changes on the fly as a user does it. So we put filters along the side so that they can actually do that. Another example, this is all at first patient in. So we have another example by Michael Mertz, having a look at the data, maybe a look further along and a more complex visualization. Michael?
Thank you very much, Joe. Spotfire for looking at safety data while the clinical trial is still ongoing. And I would like to guide you briefly through a systematic graphical workflow I'm using to look at clinical safety data after database lock. I have maybe upfront to apologize to some of my Novartis colleagues because some of you actually have seen my 2 introductory slides before. I have been using them repeatedly over the past couple of years, but I think they are still as topical as they have been a few years ago. And the data may possibly also look a bit familiar, and the topic will look familiar to the audience anyway because it's focusing on liver safety data, which Mark Lamprecht has been presenting on this morning already. So some of the stuff will look familiar, but I hope there's also some new stuff for you in there. So let's briefly look at the standard process that we are still using to analyze our safety data. So we're starting out with a project team. The blue guy in the middle is the program statistician or the project statistician, and the team plans very carefully their study. They're writing up the study protocol. They are generating the data in the clinical study, and then they are usually handing over the data to the project statistician who is looking at the data and then is producing output in the format of data tables, listings, and maybe also some standard graphs, which is already quite a time-consuming process. And at this point in time, the project team, for the first time, has a chance to see their data. So this is the time when they can start looking at safety signals, start interpreting safety findings, and they may find some interesting stuff in there. So they may decide to go back to the statistician and ask him to test certain hypotheses, to produce maybe a certain specific plot in order to help them better understand the data. And this is a circle that can go on quite often. It's pretty time-consuming. It's not necessarily perfectly efficient. In the end, the team will write up a study report and plan for follow-up, but as it is not necessarily the most efficient process. So there is possibly an alternative that we are speaking about today, which is adding just one step after the data has been generating, which is interactive graphical data exploration. And basically this is done in a sub-team of the clinical team, exploring the data using interactive software like Spotfire, identifying which plots are most suitable for the study report or for any submission document, and defining hypotheses that need to be tested in more detail. So this is the stuff, and the program statistician, by the way, of course, is a part of that team, has to be a part of that team. And after that's done, the project statistician can start to work in a focused way on those predefined hypotheses, generate the plots that are needed by the team, and if everything goes well, the team has within just one loop the output that's needed in order to write up the study report, and hopefully everybody's happy after that one iteration of the circle. That's something we have been discussing repeatedly over the past couple of years. I think it's really a useful step to add, and I will show you just one example of some liver safety data that exemplifies the concept. So maybe just one word up front on Hy's law. This has been mentioned this morning already. I don't think we have to go in much detail here. Part of the plots is using Hy's law and visualizations of Hy's law, so just as a repetition. Hy's law is defined by, first of all, your drug causes transaminase elevations more often than your control. Then some subjects show a combination of bilirubin and ALT elevation exceeding certain thresholds. And finally, you don't have any other reason that can explain these liver findings. And this is a crucial signal for the agency, specifically for the FDA. And part of the FDA guidance states that if you have one Hy's Law case in your file, it's pretty worrisome already. If you have two cases in your file, depending on the indication, of course, you may be pretty doomed in terms of submitting that drug and getting it approved. So this is Hy's Law, and let's look at how this is being visualized the way the FDA does it. This is what the FDA has coined the EDISH plot. It's a basic log-log plot of bilirubin versus ALT. And you see the Hy's Law thresholds displayed in green lines, and you can see very easily that in the upper right quadrant, these are the potential Hy's Law cases. These are the cases where ALT exceeds 3 times the upper limit of normal, bilirubin exceeds 2 times the upper limit of normal, and so you can easily spot the most relevant cases. You can also pick one of the cases, select one of the cases, and then you get a link to the narrative. I can't demonstrate that because the narrative is sitting on a SharePoint site here, but that's exactly the process that the FDA is using, and we can basically anticipate what the FDA is doing with our data by using that kind of visual approach. So you get the link to the narrative of that patient. However, there is still some deficiencies with this kind of plot because Hy's Law looks at ALT and bilirubin peaks, so these are peak values of patients displayed on the slide. The slide or the plot, the EDISH plot, does not tell you anything about the sequence of these peaks. So it doesn't tell you which was first ALT or bilirubin peak, but that's key information because if you have a bilirubin peak first and ALT going up afterwards, that's totally irrelevant. Nevertheless, that data point will be shown in the upper right quadrant, in the Hy's Law quadrant. So you want to know which of these data points in the upper right quadrant actually has the right sequence, which is ALT going up first and bilirubin going up next, or also going up simultaneously. Another key information is the time interval between both peaks. If you have an ALT peak today and the bilirubin peak 6 months later, totally irrelevant. So you want to also display time information on the plot. And finally, there is a crucial variable to bear in mind when interpreting Hy's Law. Whenever your alkaline phosphatase, another liver test, is elevated in the initial phase of liver injury, then this is by definition not a Hy's Law case anymore. However, also those cases with elevated alkaline phosphatase, they show up in the upper right quadrant. So what you would like to know basically is which of these 12 data points in the upper right quadrant in the treatment panel actually is a real Hy's Law case. And we are therefore using some modified version of the EDISH plot that includes all that information. So this uses color coding for the sequence of the events, with the red data points being bilirubin following ALT. It uses shape coding for the information on alkaline phosphatase, or the R ratio, which is equivalent to indicate hepatocellular injury, so the more worrying kind of liver injury. So any open circle is having the alkaline phosphatase elevated, any closed circle is having alkaline phosphatase in the normal range. And finally, time is coded by 1 over time interval. So the bigger the data point is, the shorter the time interval is. And that makes it very easy to prioritize your data points in the upper right quadrant, right? Because you're looking for red filled large circles, and there's only one of them. So if you have a large number of potential Hy's Law cases in your file, and think about oncology drugs, you may have a relevant number of potential Hy's Law cases. This helps you to prioritize those cases and focus on the ones that are the more relevant ones to start with. Okay, you can then also click on any of the data points, and well, again, you have the link to the narrative here. Now, this is one clinical program that I used just to exemplify the Hy's Law issue. Now, let's look at another program which doesn't have Hy's Law cases, but it has several cases that exceed 3 times the upper limit of normal for ALT, so cases of also relevant interest. What you can do in this version of the EDISH plot, you select one case and you get the time profile of the respective patient for ALT displayed next to it, and you can select all other liver parameters in addition to see what's going on in that specific patient. Then another key information is how are shifts from baseline performing across treatment groups. Sorry, that takes again some time here. Good. So what you can do is you can plot visits in the columns, you can plot treatment groups in the rows, and then have color coding for the different liver tests. That is not yet very informative, so let's just select the visits that are the most relevant ones. What you have on the x-axis here is baseline visits as normalized values, so multiples of upper limit of normal. On the y-axis, you have the respective post-baseline visits, and you can easily see that there is a time trend over the visits. For example, for ALT, you see that ALT shifts from baseline are increasing from visit 4 to visit 10. An increase is indicated by being a data point above that blue diagonal, which is the line of identity. So you can see that information very nicely, and you can see that there is not so much going on for alkaline phosphatase, which is the blue data points. So that simple plot gives you a lot of information on time trends of changes, which parameters are most affected, and what are the treatments associated with the observed effects. By the way, you may have observed that I'm not using the filter panels that Spotfire is providing to help you filtering through all the variables. I'm using bookmarks, which is predefined sets of analysis that just helps me prevent messing up the presentation, because you have to be very careful about how you select your filters, and bookmarks are a very nice tool that help you reproduce what you have done before. So these are baseline shifts. Then let's look at time profiles across the different liver tests. What you can do if you look across the 4 key liver tests here is you can select a certain patient, and you can filter down to that patient. And now you have all the relevant liver tests of that patient displayed in parallel. So you can see very nicely the patient had elevated ALT, elevated AST, but fortunately no bilirubin elevation and also no alkaline phosphatase elevation. So you get all the relevant sets of liver tests in one display. Then let's look at time profiles of liver tests across all patients. That looks pretty confusing because now each panel is one patient and you have all liver tests displayed per patient, but you can simplify that by filtering for flags. So just look at patients that had elevated ALT. So what you can see now basically is very relevant information when assessing liver safety. You see that several patients just had short-lived peaks of ALT. The vertical red line is the end of treatment. So you can also see that actually most patients adapted to the effect on the liver, if there's any effect on the liver here. So that signal of adaptation is relevant. It shows you that your liver safety profile may actually be quite benign. Then you can, from that plot, select a certain patient of interest, which then, that's this guy over here, which then takes you to the patient profile. The patient profile shows you the time profile of your biomarker of interest. It shows you adverse events and concomitant medication all on the same time axis. And so you can associate certain convents and certain adverse events with ALT peaks, and you can zoom into that a bit so you can see the peaks more clearly. You can also zoom into the time axis. And what you can see on, well, actually, what you can not see on the plot because the resolution is not the way it should be. This patient had a drug called NyQuil, before the first ALT peak, so that's this concomitant medication here. NyQuil contains paracetamol. That could easily explain the ALT elevation. However, if you look at the second and the third ALT peak, you don't see any suspicious concomitant medication here. But the patient had headache, and again, you have to believe me that there is headache somewhere here, because you don't see it. No, that's not it. Yeah, that's the headache. So this is the headache event that started before the first ALT peak. And if you look across the time axis, there is more headache here, and there's a headache also somewhere here. So that was a patient with repeated headache episodes. And we had a very similar case, not that one, but a similar case in one of our development programs where a patient had massive ALT elevations, massive bilirubin elevations, actually would have been a Hy's Law case. The patient didn't report any suspicious concomitant medication, but he reported headache. So looking at that kind of plot, we asked the clinical team to go back to the patient and query the patient specifically. Could it be you have taken some painkiller to treat your headache? And guess what? The patient had taken a high dose of paracetamol, which explained the ALT peak, which explained the signals of liver injury, and which explained away the potential Hy's Law case. So just looking at that kind of information graphically can help you a lot to identify underlying reasons for observed biomarker findings in this case. And with that, I would like to finish. Thanks for your attention, and we are both happy to take questions.
Is there any questions?